Bronchitis is a respiratory condition. Look at this picture, shows that inflammation of bronchial tubes. Introduction. Bronchitis is a respiratory condition characterized by inflammation of bronchial tubes, the airways that carry air to the lungs. This condition can significantly impact a person's quality of life, leading to symptoms such as coughing, mucus production, difficulty breathing. Definition. Bronchitis is defined as the inflammation of the bronchial tubes which results in swallowing and irritation of the airways. It can be acute or chronic, with varying causes and symptoms. Types. 1. Acute bronchitis. This type is typically short term and often follows a respiratory infection such as cold or the flu. It usually lasts for a few days to a few weeks. Second, chronic bronchitis, a long-term condition that is part of chronic obstructive pulmonary disease, COPD. It is characterized by a persistent cough that produces mucus for at least 3 months in 2 consecutive years. Causes. 1. Acute bronchitis, usually caused by viral infections, but bacterial infections can also be responsible. Common viruses including influenza and rhinovirus. Second, chronic bronchitis, predominantly caused by long-term exposure to irritants such as tobacco smoke, air pollution, dust, and chemical fumes. Risk factors. 1. Smoking, the leading cause of chronic bronchitis. Second, exposure to irritants, environmental pollution, dust, chemicals. 3. Weakened immune system, more susceptible to infections that can lead to acute bronchitis. For age, both the very young and the elderly are at high risk. 5. Gastroesophageal reflux disease, can expectable bronchitis symptoms. Complications. 1. pneumonia. Infection can spread to the lungs. Second, chronic obstructive pulmonary disease COPD. Chronic bronchitis can lead to worse COPD. Through respiratory failure, severe causes can impair the ability to breathe. Pathophysiology. In bronchitis, the lining of bronchial tubes become inflamed and swollen. This inflammation leads to an increased production of mucus, which can block the airways and cause coughing and breathing difficulties. Chronic bronchitis, repeated irritation cause the walls of bronchial tubes to thicken and narrow, leading to long-term respiratory issues. Signs and symptoms. Persistent cough, production of mucus, sputum, which can be clear, white, yellowish gray or green, fatigue, shortness of breath, slight fever and chills, chest discomfort. Medical diagnosis, clinical examination, listening to the lungs with stethoscope. 2. Chest X-ray to rule out pneumonia. 3. Sputum test to identify infections. 4. Pulmonary function test to measure lung function. 5. Blood test, check for infections or other conditions. Nursing diagnosis. 1. An affective airway clearance related to increased mucus production. 2. Impaired gas exchange related to inflammation and mucus. 3. Activity intolerance related to shortness of breath and fatigue. 4. Risk for infection related to weakened immune system. Management and treatment. Medications. Bronchodilators to open airways. Steroids to reduce inflammation. Antibodies for bacterial infections. Cough suppressants to manage severe coughs. Therapies. Pulmonary rehabilitation, exercises and education to improve lung function. Oxygen therapy to severe cases of chronic bronchitis. Lifestyle changes, smoking cessation, avoiding lung irritants, using a humidifier, staying hydrated, Psychosocial medicine. Chronic illness like bronchitis can lead to significant emotional and psychological stress. Support groups, counseling, and stress management techniques can be beneficial in imaging and psychosocial aspect of living with bronchitis. Prevention. Avoiding smoking and exposure to second-hand smoke. Wear protective equipment if exposed to dust or chemical fumes. Maintain good hand hygiene to prevent infections. Get vaccinated against influenza and pneumonia. Conclusion. Bronchitis, whether acute or chronic, is a condition that requires careful management to prevent complications and improve quality of life. Understanding the causes, symptoms, and treatment can help individuals and healthcare providers effectively address this common respiratory issue. Early intervention, lifestyle changes, and appropriate medical care are essential in managing bronchitis and preventing its progression to more serious conditions. Thank you. Have a wonderful day.